Breaking now, Meriter Hospital monitoring a patient for potential exposure to Ebola. Dane County Health Department confirming a patient is being monitored for Ebola symptoms.
We want to stress, though, there is no risk to the public. That's what health officials are saying. News 3's Dave Delozier is at Meriter Hospital tonight with the latest details.
Yeah, Michelle and Eric, here's what we know right now. We know that on this past Monday that one patient was brought here to Meriter Hospital with suspected symptoms of the Ebola virus. That patient is being held here at the hospital in an enhanced isolation unit. That patient we do know had been traveling to West Africa, and because of that, they were being monitored by local health officials, and when they became symptomatic, that's what triggered them being brought here to Meriter Hospital. Now, some good news. This past Monday, this patient was given a baseline Ebola test, and it came back negative. That patient is obviously still going to be held here for the next 21 days, and in a few days, they will be retested. But as of now, the news is good that the test came back negative, that baseline test. Now, all of this follows a protocol that Meriter has been practicing for months.
It's important to immediately isolate the patient to prevent any potential exposure to the healthcare workers or certainly to the public. Once we have the patient isolated, that we keep them in a very strict enhanced isolation environment until we can confirm that the disease is not present.
Now, a bit of context with all of this. Since the Ebola outbreak last year, there were 5 confirmed cases of the Ebola virus in the U.S., but the CDC also reports that there were nearly 500 individuals in this country who were monitored for suspected symptoms similar to this situation, and in those nearly 500 cases, they came back negative. They did not have the Ebola virus. Also, a bit of context. The Ebola virus, which obviously was out of control in the past year, in this last several weeks, the cases have been down under 200 cases. So the Ebola virus has well passed its peak in Africa. We'll continue, obviously, to monitor this. One other piece of information. This is a level 2 Ebola treatment facility. That's where they take patients who are suspected of having Ebola. If that changes and if it becomes a confirmed case, this patient would be moved down the street to UW Health.
All right. Thank you for putting that into context for us, Dave. Appreciate your reporting there. We do kind of want to continue this. We know this patient is joining about 30 others who've been observed by Dane County public health officials.
Yeah, they're very cautious in these matters. Are those patients monitored because they had recently visited West African countries? Now, today's case, the first since October. Again, it doesn't mean that this patient has the virus. Officials will simply monitor the patient for 21 days to see if any symptoms surface. Right now, there are no cases of Ebola in the U.S., according to the CDC. 4 patients have had Ebola in the U.S. since last year, with 1 death.
Now, 4 hospitals in Wisconsin have the capabilities to treat Ebola. That includes UW and American Family Children's Hospital right here in Madison, and Children's Hospital and Froedtert in Milwaukee. Stay with Channel3000.com for the newest developments, and of course, we will have the latest tonight on News 3 at 10 o'clock.